A stroke happens in two ways. The first type, which is the most common stroke, is called ischemic stroke. It happens when a major blood vessel in the brain is blocked by a blood clot or cholesterol buildup inside one of the brain arteries. For example, a blood clot formed elsewhere in the body travels through this artery, making its way to the brain. The clot finally enters the brain and blocks the blood flow to brain tissue in one area, and the cells of that area of the brain die within minutes. The right hemisphere stroke affects the left side of the body. Another example is that a cholesterol buildup in an artery of the brain may also block the blood flow to the brain tissue, and the brain cells in that region instantly die due to lack of oxygen and nutrients. The second type of stroke is called hemorrhagic stroke. A hemorrhagic stroke happens when a weakened blood vessel inside the brain breaks open and leaks blood onto the brain tissue, putting pressure on the brain cells and damaging the brain tissue in that specific region. But this is a less common stroke. And finally, there is a mini stroke called transient ischemic attack, or TI in short. This lasts only a brief period, and it is caused by a brief blockage of blood flow to a specific area of the brain by a clot. Then, the clot disintegrates quickly, and blood flow to the brain tissue restarts quickly. This type of stroke does not cause significant long-term damage to the brain. Okay, what are the symptoms showing that a stroke has happened to a person? The symptoms include the following. The person may have trouble speaking or understanding what others are saying. The person may suddenly lose vision in one eye or both eyes. A person may have dizziness or problems with balance or coordination. A person may have a problem walking. A person with a stroke may experience a sudden severe headache. The person may have a seizure or loss of consciousness. How do you check if the person is experiencing a stroke and needs immediate medical attention? Use these four letters fast for face, arm, speech, and time. For the face, ask the person to smile. Is one side of the person's face drooping? For the arm, ask the person to raise arms. Does one arm drift downward? Ask the person to repeat a simple phrase. Does the person have difficulty speaking? Call emergency immediately for the person if you see any of these signs.